Hi, I'm Celia. I'm one of the Women's Health Physios at My Physio SA for her, and today we're going to do another educational video talking about rectus abdominis diastasis, which is the separation of the abdominal muscles. So this commonly occurs in women during pregnancy and happens for a few different reasons, but one of the most common is as the baby's growing, there's more and more pressure on the connective tissue around the abdomen, and mainly the connective tissue that runs between your two rectus abdominis muscles, which are the muscles that form the six-pack through the front of your abs. So what that looks like is as the muscles start to spread, there becomes a widening or a gap. This can be quite small for some women and they often don't even notice they have one, but for some women that can be quite wide, often up to 5 fingers or more apart, and can lead to quite a lot of problems relating during the pregnancy and postnatally when they're trying to recover as well. Some of these issues that can come about from having a wide separation include back pain, pelvic pain, problems with how your pelvic floor is functioning, as well as breathing and respiratory problems from not having good support through your abs. So today what we'll go through is how to check if you've got a diastasis or separation yourself, and if you do have a separation, some things that you can do to avoid making it worse, and some alternatives that you can do exercise wise to help improve or bring that separation back together. So to check if you have an abdominal separation yourself, lie on your back on a bed or a firm surface. This is safe if you're pregnant because you'll only be doing it for a short period of time. Place one hand behind your head and the other hand with your fingers pointing towards your toes, down around about your belly button. Come just above your belly button so you can feel, you should feel if you're relaxed, the muscles on either side and a slight divot in the middle of your belly. Then lift your head and your arm just off the bed and you should feel the muscles tense and a slight softer patch in the middle. If you have a bigger separation, you might be able to palpate deeper, and you might need to feel side to side as you might have 2 or 3 finger separation between the abdominal muscles. Relax your head back down and feel again now below the belly button, and do the same movement with your head and your arm coming just off the bed and feel if there's any gap between the muscles. That's how you test the 2 areas of the abdominal separation. So this exercise is a good way to start activating your deep abdominals and your oblique muscles, which will start to knit together the separation. Starting with one leg, slide the heel away along the bed, straightening the knee, then slowly bend the knee back to bring your foot back to the start position. Complete this alternating legs, trying to keep your tummy reasonably relaxed, still able to breathe. If you're feeling comfortable with that, you can add the opposite arm extending above your head as you straighten the leg away, coming back to the center with the foot and the arm back down by your side. So now you've checked if you have an abdominal separation. There's 2 things to think about. Firstly, if you are pregnant, you're not going to be able to fix this until after you've had your baby. So the best thing you can do is avoid making it worse by avoiding activities that strain your six-pack muscles. So this is things like when you're getting out of bed, make sure you roll onto your side and then sit up, not sitting straight up out of bed. Avoiding abdominal crunching exercises because that widens the gap further, or exercises such as planking, which involves a lot of straining through the rectus abdominis muscles. If you have had a baby recently, we're wanting to help those muscles knit back together. So to help do that, pelvic floor strengthening is a really great way to do that because it puts no extra load on that muscle or that connective tissue, and it helps bring the lower abdominals and the oblique muscles together, so it helps knit the inner layers of the separation back together as your body recovers from the pregnancy. You want to avoid still overstraining, so avoiding sit-ups and planking until that separation has healed. That could take up to 6 months or longer. If you have any queries about that, make sure you see a physio who can advise you in some appropriate exercises. If you're down the track from your pregnancy 2 or 3 years on, you may not notice that there's a huge separation, but there still could be some gap left. This may be related to some ongoing issues with back pain, pelvic pain, or pelvic floor issues, but you won't be able to close that gap with any exercises. What you can do is optimize how the rest of your body is working, either working on pelvic floor strengthening or the remaining abs, but again, you won't be able to get much more strengthening or closure through that separation if you're years on from your pregnancy. So in summary, it gives you an idea of how to check the separation yourself, some simple exercises to start with to help close the gap after your pregnancy, and check out the links below for any more information about abdominal separation and how to check this yourself.